helping you discover facts about your health and expanding your access to well-being.
All right, we are coming in soon.
Tune in to
Okay.
On the Drive.
So your
connection with your body.
people should be able to check us out on YouTube now.
Every Thursday
Okay.
at 5:15 p.m.
I just put that up now.
All right. We are going in. Smooth 98.1. Love music, love life. You're welcome. This is Soul Food segment of Breakfast in Bed 98.1. Thank you so much for joining us. My name is Oluwaseun. Right now, you can actually join the stream. I'll tell you how you can be a part of the conversation so that you do not miss out on anything. And also, if you have a question, if you have something to clarify, as usual, you can. So let's start with YouTube. Go right now to our YouTube channel because we are streaming live. So go to www.youtube.com/Smooth91 FM Lagos, or better still, just go to YouTube and search for Smooth 91 FM Lagos. And when you're done, just click on that subscribe button and then the notification bell so that whenever we go live, you see the notification and join us. And then on WhatsApp, you can send your messages to 0809-444-0981. You can call the number 01448-9981. And when you're on YouTube, you can actually drop your messages in the chat box option. Now that said and all cleared, let's get to the conversation this morning. I mentioned earlier and over again that the topic is urinary incontinence, the causes, the symptoms, and treatment. I do have a specialist in the house, one who is not new to the show. Very thankful and I am very grateful this morning. His name is Dr. Chigozie Onyeze, and he is a urologist. Good morning.
Yeah, good morning, Sean.
Thank you so much. I appreciate it this morning.
Yeah, thank you. Thank you for having me.
Okay, so let's quickly maximize the time we have and get right into the conversation. As usual, we have to start with the basics. What is urinary incontinence?
Urinary incontinence has to do with inability to hold urine. Okay, so I mean, everybody urinates at one point or the other, and it has to be in an acceptable place and in an acceptable time. Yeah, I know people do otherwise, okay, but incontinence is referred to, or we talk about incontinence when someone is unable to hold his or her urine or urination until an acceptable time and place. It could also be said to be the involuntary loss of urine. I mean, you're in the middle of an activity and somehow, poop, urine seeps down and you're looking for how to cover up, that it could be embarrassing sometimes. So the involuntary loss of urine or the inability to hold urine until an appropriate time and place. So that's usually what we'll talk about urinary incontinence.
When you said involuntary loss, it sounded funny. And when you said in the middle of an activity, because what came to my mind is those times when you sneeze and it's like something just escapes. Is that part of it?
That is part of it. I mean,
oh, wow.
that we'll come to that. That's part of what we'll call stress incontinence. Okay, we'll come to that part, and it really can be embarrassing. I mean, somebody just does an activity maybe in the public gathering, and her clothes is soiled, and she's looking for. Sometimes they remain seated because if they stand up, their chair is a pool of urine, so they have to remain seated while everybody is gone and find a way to cover up. It's both a health issue and a social issue. I've had to treat people who are having marital problems because of incontinence. It can be that bad. It's also, when we come to the causes, we will discover that part of the causes is what we call fistulas, okay? And there are men who have taken up other wives because of this issue. They can't deal with the loss of urine, with the smell. I mean, it's a whole lot to deal with. And I think that's why we're talking about it today, so that people can be enlightened and know what to do to prevent these things or how to manage it appropriately.
Well, let's get right into the types now, because you already started by saying stress. Stress is one of it. So let's get to the types of urinary incontinence.
Okay, so there is the International Continence Society that have been able to describe the different types of incontinence. The first is what we refer to as urge incontinence. Usually, when the bladder fills up, you get a first nod of the bladder to say, hey, I'm getting filled gradually. You can still hold it. Then it comes again after a certain volume to say, man, you need to get up and pee. Okay. And then if everything is okay, you can go up and pee at that time. And then the bladder can still hold, sometimes maybe you're traveling, the bladder can still hold this urine for a very long time. I mean, to a maximum bladder capacity. Okay, but sometimes when this urge comes, people are not able to hold that urge or resist that urge. They must leave immediately. And that is what we'll call urge incontinence. So it's referred to as the involuntary loss of urine that is associated with an irresistible urge. Okay, either the urge comes before or comes after, but there's an irresistible urge to urinate. So that's what we'll call the urge incontinence. And the urine volume might just be small. It's just that the man must get up immediately to go and pee. So somebody's in the middle of a meeting and he gets up to pee. It's a 2-hour meeting and he has stood up 4 times to pee within a 2-hour meeting. Okay, even when you do Zoom meetings, occasionally you see people, sometimes they'll put up their videos because they want to pee. They come back, they put it on. I mean, you could do that several times. And that's what we refer to as urge incontinence. So he's not able to resist the urge to pee. And the thing is, sometimes the urine, the man might actually be on his way to the toilet and then he pees before he gets to the toilet. Sometimes he pees on himself. Okay, we'll come to the details of this much later, but that's what we'll talk about, the urge incontinence. And then the other one we talked about was a stress urinary incontinence. This comes with activities that will raise the, what we'll call the abdominal pressure. So either one is coughing or one is sneezing, anything that raises the abdominal pressure. Sometimes it can be bad that somebody is changing position, either she's getting up from a sitting or a lying position. That transient rising abdominal pressure will just make urine seep, and that's what we'll call stress urinary incontinence. It can be mild. I mean, mild meaning that it's only when the person shouts or strains or jumps, that's when it happens. Then it can also be severe, meaning just getting up from a sitting position can lead to a loss of urine, and it can be very troublesome. And sometimes these things, there are no clear-cut, unlike what is written in the textbooks, there are no clear-cut distinction between them. Sometimes one can have the two, and that's referred to as mixed incontinence. So she feels the urge to urinate, and she's not able to hold it. At the same time, as she's standing up to pee, or as she's maybe walking or sneezing, it comes up. So it's a combination of the two. And when you have that mixed incontinence, one may be bigger than the other. I mean, you can have the stress component being the major factor or the urge component being the major factor. But these are the main types of urinary incontinence. The other things that perhaps one should know about are what we'll call, overflow incontinence. I mean, it's not very common. It's what you find in elderly men most times. These guys have either prostate issues, they are not able to urinate well. So it's like a full tank. That's how I would give the analogy. If you pump water into an overhead tank, the ideal way for water to come down to the house is through the pipes coming down. But sometimes if the pipes are closed down, he's not emptying well, you see that the water could come up from there are these fenestrations at the top of the tank. So that's how we know that the tank is full. That's like an overflow. It's the same thing. So the man has got urine in his bladder, maybe 1 liter or 2 liters, and he's walking around, and then insensibly, urine just pours out, and he doesn't know, he's not aware. He just sees that sometimes he sleeps and he wakes up and he finds out that he has bedwetted. Okay, so this is what we refer to as the overflow incontinence. So he's got urine in his bladder and it's just overflowing. So that's part of the different types of incontinence. There are other things too. Those ones are not major. They are not very common. The total incontinence. The total incontinence is maybe women who have fistulas, vesico-vaginal fistulas and bladder fistulas. Okay, so those ones, they leak urine constantly, whether they cough or they don't cough, whether they stand or sit, whatever it is, the urine just keeps, and sometimes they have to use loads of wrappers and clothing to pad up. Some people actually go on diapers, okay, just to be able to manage this. And that's the total incontinence that some people have. In children, I've had to manage children who have this abnormality in their anatomy, okay? One of their kidney pipes, we call them ureters. One of their kidney pipes is not inserted properly. It's congenital, and she's never attained continence. So she just continues to leak urine constantly. It's a social issue. People have had to leave boarding schools because of this. People have had to leave marriages because of this. People have lost jobs because of this. So it can be quite troublesome. If one is not affected, one may not understand the gravity of this situation. I mean, people who have gone through this understand how disturbing it can be. Not just the illness itself. I mean, if it's something they can contain, it's fine. It is what people around them think, and the things that they have lost, how it has affected their lives. Okay, when we come to perhaps the causes, I mean, there are a whole lot of things that people have gone through just because of some of these things we're talking about this morning.
Merely listening to you break all of this down is troubling to me, really troubling. So I will just take a moment to take this all in, and then we'll be back. In case you're joining us for the first time, we are talking about urinary incontinence. You can be a part of the conversation by first going to YouTube and streaming. We're streaming live. That's www.youtube.com/smooth921 FM Lagos. We will be right back.
98.1. It just feels good.
That is very disturbing.
Love life. World-class music.
So when you sit in the Lagos traffic for 4 hours coming from Lekki to mainland, and you're still able to hold urine, you have something to be thankful.
I mean, literally. I remember somebody joking with me one time that, this girl, you're strong, girl. You literally can stay 6 hours and hold your wee. I'm like, is that not normal?
No, it's something to be thankful for.
Oh my days. This is troubling. Jesus, thank you. Oh my word. Nah. Man, there's literally something to be thankful for all the time.
Oh yes, there is. There is.
Wow. Okay, we're coming back on.
It's not just music, it's smooth music.
Yes, it's smooth music that you always get with us. But you know, right now, if like Dr. Chigozie said, so if you're not part of the YouTube stream, you might not understand what I'm about to say. But while we went to that break, I said that I am really thankful today for the fact that at least I can hold in because it's a lot that you can hold in your urine without letting it go involuntarily. It is something to be thankful for. So if you have not thanked your creator for that today, I think now is a good time. If you have health, that is really great and super good. Well, let's get back to it. So now that we've talked about the many types of urinary incontinence, we've talked about the stress total, we've talked about mixed, we've talked about the urge. What are the causes?
Okay, so the different types of incontinence actually have different causes, okay? But largely, I would say that urinary incontinence is more common in women than in men. There's a reason for that, really. Men have a longer urethra. That's the pipe that brings urine from the bladder to the external or to the exterior, okay? And then men have the prostate, which serves as an additional support to prevent loss of urine. The female urethra, or urine pipe, is just about 4 centimeters. It's short. So you have this incontinence more common in women than in men. It's also more common in people who are advanced in age. So you have it more in the elderly than in the young chaps. Okay, so coming down to the different causes of incontinence. Let's take, for example, the stress urinary incontinence. For women, people who have had multiple child deliveries, okay, vaginal deliveries. Okay, you have a woman who has had maybe 7 children, 9 children, okay, so, and everything was through the vagina. So the vaginal wall or the pelvic floor is not as strong as it should be. Okay, so these people have a weak pelvic floor and they're at risk of having urinary incontinence. Okay, that's part of the causes. Apart from childbirth, sometimes other surgeries, pelvic surgeries for women. Some women have had their wombs taken away because of one reason or the other, or maybe had other kinds of surgery that can weaken the pelvic floor. Okay, so that can actually lead to stress incontinence. The same thing for men. Some men have had surgeries before, pelvic surgeries, prostate surgeries, and all that. That can actually weaken the pelvic floor or the sphincter mechanism. What actually keeps the urine in check is weakened. So anytime they strain, cough, sneeze, there's this loss of urine that occurs, and that's one of the causes. Okay, if you come to say the urge incontinence, okay, urge incontinence sometimes can be from repeated infection. Okay, so the chap has this urinary tract infection, and usually when people have infection, you know, the whole bladder lining is not stable, so they feel that increased urge to go and pee. Okay, so that's part of what could cause that. And then, like I said, it can sometimes be a combination of the two of them. Now, some other things generally that could cause this can be some people have stroke. Okay, it's a neurological disease. Okay, they had this, I mean, stroke is the normal language people will understand. Okay, so what people know about stroke is that, oh, the man cannot walk. Okay, he has to carry his hand or carry his leg and all that. That's what they see physically, okay, or externally, but it also affects the bladder. So the wiring system of the body, or the electrical system, or the nervous system of the body is affected. And you know, these nerves also supply the bladder. So sometimes they could have incontinence from it. There are different types that they could have from that. Okay, sometimes it's just this I wouldn't want to go into some crazy medical terms. It's not necessary. Okay, but just know that there are different types of incontinence that these chaps who have had stroke can have. Sometimes people have spinal cord injuries and they can have incontinence from that. I mean, I've had to manage patients. Oh no, it's quite touching. Involved in road traffic accident, and yeah, they're able to manage every other thing, but this urine is just troublesome. He's just leaking urine. And sometimes we have to put what we call catheters for them or divert their urine. It can be very troublesome for people who have spinal cord injuries. Okay, so these are some of the things that perhaps can be the cause for urinary incontinence. Like I've said earlier on, sometimes for those who have total incontinence, it can be from fistula. Okay, so I had this chap some time ago who, I mean, she had childbirth, teenage pregnancy, delivered in a teenage age. The pelvis, I'm not sure how I'm going to, where the baby stays. I mean, that's how I'm going to explain it. It's not well developed. I mean, you can't compare the build of a teenage girl, 16 years or 14 years, to the build of a mature 30-year-old lady. Okay, so the pelvis is not very mature. She forced it's a vaginal delivery. Sometimes they've even had to use instruments and all that. That could disrupt the whole pelvic system. And then sometimes these chaps, actually, they have what we call prolonged obstructed labor. They are somewhere in one spiritual house or one place where they keep pushing the baby, pushing the tummy. The lady is obstructed and they just leave her laboring for 3 days, 4 days. The result is she develops a fistula, and that's an abnormal communication between the bladder, okay, and the vagina, and then she leaks urine consistently. I mean, one of those people, she's had surgery 4 different times across the states in Nigeria. I mean, some in Jos, some in Lagos. One of them had actually gone as far as Benin Republic to have surgery done. When I was interacting with her, it was touching. I mean, it was literally quiet, listening to everything this young lady had gone through. I mean, and what brought her to us was the fact that she was incontinent, but having to listen to her, all the things she's gone through, it was pathetic. Okay, so these are some of the causes. And then, like I said earlier on, sometimes it could be anatomical. It's not the fault of the chap. It could just be anatomical. Ideally, the pipes that bring urine from the kidney down into the bladder, ideally it's a normal connection from the kidney down into the bladder. Okay, but sometimes these pipes can connect lower than the bladder, so they go just below the bladder to insert. So one of them will insert into the bladder, so the patient or the person is able to urinate normally. Okay, but the other pipe is not able to insert into the bladder. It inserts below the bladder. If it's a man, that wouldn't be a problem, because like I said, the prostate is there, and there's what we call the external sphincter just below the prostate, so that can help men in some way. But in women, the urethra is short, just below the bladder, so anything that misses the bladder leads to incontinence in women. So I mean, these are some of the reasons why we say incontinence is more common in women than in men. Well, another way of looking at it is that women seek health care, more than men. These men, they hide a lot of things. Don't mind them. The men hide a lot of things. I mean, it is until it is hooking them, like they want to die. That is when they will come up. But the ladies usually would come seek for health. And I know some people delay because of either poverty or ignorance, and all that. But largely, women seek for healthcare better than men. But in this case, incontinence is more common in women than in men. Okay, I've gone through the different causes. Repeated pregnancies, like I said, is a major cause of incontinence. Infection is also part of it. So these are the various causes of the different types of incontinence that we have.
I really just want to rush into the treatments, because all the things that you have broken down, very educative, very enlightening, but I don't like it. I don't like it. It sounds really ugly and doomy. But let us first talk about the possible risk factors. We have talked about the causes. For instance, in the case of fistula, the one as a total incontinence secondary to fistula, I can guess, early teenage pregnancy is a risk factor. But besides that, what are some other risk factors generally for?
Okay, so like you alluded, early pregnancy or teenage pregnancy, yes, can be a risk factor for this. Sometimes they do these instrumental deliveries. If it is done by an expert, it's like driving. If an expert drives you, perhaps you even know when you enter pothole. If an expert does the procedure, it's fine. But when people start cutting corners, you didn't learn it properly. You just did some 3 months in one hospital somewhere, and then you open something behind the chemist, and you're doing some, it's sometimes it's not very good, because some of those guys, they cause more damage. Sometimes we spend time managing the damage caused by others and not the problem itself. It is the complication we are dealing with. Okay, so instrumental deliveries is part of it. Instrumental deliveries, if it's not done properly, prolonged obstructed labor is part of it. Okay, these are some of the things that, moving away from this, the other things that perhaps obesity is a cause, or I would say is a risk factor. Obesity, fatty infiltration of the whole abdomen, the whole body. Okay, so obesity is one of the factors. Sometimes smoking. Okay, people who smoke, they sometimes would have cough, and sometimes it can be what we call chronic cough. Okay, so they cough a lot. These things can lead to stress incontinence. So obesity, I've talked about obesity, talked about chronic cough. I mean, sometimes even our diet, some people are constipated. Some people are constipated. So the reason they're having incontinence is because they don't, somebody stays and is not going to toilet. He goes to toilet once in 2 weeks. That's not really a healthy habit. Okay, sometimes it's not a fault of theirs. It's just what they found. It's just how their body works. Okay, but they need to seek health care. Okay, recently where I work, a lady was complaining about her mom who was becoming urinary incontinent, and that was just on Monday. And we said, is she constipated? She said, yeah, she's constipated. I said, can we deal with that? And they dealt with that. I mean, I still saw her on Thursday, and I said, "How is your mom?" She said, "Oh, my mom is fine. The constipation is dealt with, and then she's continent now." Okay, so we're happy. So you see the impact of constipation on incontinence. Okay, so sometimes the things we take, like caffeine, okay, you take a lot of tea, coffee, caffeine, and all that. These things are stimulants, and they make you urinate excessively. Okay, so and then that could translate into incontinence. Okay, then we also talk about some people are on medications for other things, okay, and that is making them produce large amount of urine and sometimes could predispose them to having incontinence, okay. These are some of the things. Some people have prostate issues, and that is a basis on which these other things or symptoms can build up. I mean, these are the different things that perhaps could cause that. Alcohol is a delicate area. When people take large amount of alcohol, Friday evening things, large amount of alcohol, okay, they tend to produce lots of urine. And sometimes, I'm sure you've seen the pictures. I mean, we've all seen these things. You see the girls lying in the pool of their own urine. You see the guys. I mean, that's the impact of alcohol. Yeah, it is for them, or for these things, it's transient because it is while the alcohol lasts. So some
But if
people
you
have
repeatedly do that, can it lead to something else more prominent?
Well, I don't think that repeatedly or taking alcohol repeatedly it's just while the alcohol. I mean, you don't get drunk beyond the period of the alcohol. So it is, so long as you drink, so long as you drink excess, I mean, you're at risk of some of these things. And then some people have what we call cognitive impairments, meaning that they don't know themselves. They can't understand. They are, I'm not sure how to say it. You need to help them. They have cognitive impairment. I don't know what lay language to use for that. So these are people who perhaps maybe they have what we call dementia or delirium or something. I mean, they don't know themselves. And then sometimes when they come out of it, they're like, did I really do that? Oh, that's not me. That's not me. Okay, so these are things that perhaps could lead to some of this, but it's transient, except if it's a permanent cognitive impairment. Now, the other part is some people are not mobile. I've seen people who maybe have fractures, maybe they have some debilitating illnesses that keep them bedridden. If they are bedridden, they can't get up to go and pee. And sometimes when the urge to pee is there, they can't hold it. Some people do not even have a sense of whether they are having, they don't even have the sense of whether urine is there or not, okay? They don't have the sense or the urge to urinate. So as it is coming, it's going, okay? And that can be troublesome. That can be troublesome for the patient or for the person, because sometimes you find these chaps lying in the pool of their own urine, okay, and it's not good, okay. That's also troublesome for the people taking care of them, okay, financially, socially. Okay, you come into a room. I've gone to see someone somewhere in Bagada one of those days, and it was just, the whole room was not so wonderful, okay. And you see, it's a social issue. Even the children do not want to come into that room because of the stench. Okay, these are things that people are having to deal with. And then for those who can afford it, they have to buy diapers. Okay, if you buy diapers, how many diapers will you use in a day? You have to use probably 3 or 4 in a day. You know the way things are in the country at the moment, it's quite expensive. Then even if you buy the diaper, the man you're buying it for cannot wear himself. You would have to come and wear him. You can't leave your work and come and change diaper at 11. You're a busy person. Nobody wants to. I can't leave my job and come and be doing all that. So you have to employ somebody else. So it tells on people's finances. It tells on people's psyche. It tells on the social aspect. It tells on the health of the other guys in there. So, I mean, don't let me bore you. It's not very interesting, but these are things that people, and sometimes I try to let you know about how these things are. Sometimes long travels can be a cause. I was in one of those luxurious buses some years ago. I think it was Ifesinachi bus or so, coming down from the east to Lagos. And this lady kept saying, driver, stop, driver, stop. She needed to pee. Unfortunately, where we were, the driver could not stop. You know, now there are some places you are not permitted to stop, either because of security reasons or because of some other reasons. The driver couldn't stop. And all we saw was that the color of her jean changed. She just peed on herself. It was embarrassing. It was embarrassing. Okay, so that's like an incontinence. So sometimes if people do not empty their bladder in time, maybe when we stopped shortly before that point, she perhaps was busy eating or drinking and didn't have the time to empty her bladder, or maybe she had a medical condition. But these things are real. I'm sure the listeners perhaps would have their own experiences of people maybe who are close to them or who they have seen. I mean, the jean of the lady just turned from blue, light blue, looking very kinky and sweet, to very dark, urine salt smelling, wet kind of stuff. So this is what people go through. And then people who don't have these issues, sometimes they don't understand. You are in a bus and a man is shouting, driver, stop, driver, stop. Somebody will say, Oga, no stop, oh, Oga, no stop, oh, no stop. Oh. I mean, if it is safe to stop, the driver should please stop. Perhaps if it is safe to stop, because you don't know what these people are going through. And it's going to be embarrassing for everybody in the vehicle if they get to pee on themselves. Okay, so these are some of the
Let's quickly
things.
go to the treatments, because we actually can spend the whole hour talking about this. So let's talk about the treatments. How do you treat this condition?
Okay, some of the treatment for urinary incontinence, like I said, is tailored towards the individual, is tailored towards the causes. Okay, I'll start with the stress urinary incontinence, which is the most common incontinence in women. 80% of the times when women have incontinence, it's stress urinary incontinence. We've had to deal with that a whole number of times. Like I said in the risk factors, obesity. Okay, if somebody is obese, try and shed some weight. Shedding weight will help if someone is obese and is having some of these incontinence issues. Okay, apart from that, you also want to do what we call the pelvic floor exercise. So do you know people who carry weight, who go to the gym and carry weight?
Yes.
You know how they build their muscles?
Yes.
The way you are smiling, it looks like you have carried some
different
weight.
types of weights, yes.
Exactly. So the way people build their muscles, okay, when we're young, we used to have Okogan and Ultimate Warrior and all those people. I'm not sure whether we were born that time, so you will know what I'm talking about. They used to show it every Saturday on NTA. Okay, so the way people build their muscles, the physical muscles you see, is the way people can also build their muscles, the internal muscles that you do not see. And how to do that is by doing pelvic floor exercise, or what they call Kegels exercise. Okay, so Kegels exercise actually helps to build the pelvic floor. So the muscles that I talked about earlier on that have become weakened from repeated pregnancies and vaginal deliveries, that perhaps had become weakened from previous pelvic surgeries and all that, those muscles become strengthened and thick. But like the normal weightlifting, if you carry weight one day, you say, just one Saturday, you say, my muscle is now big, it's lie. You have to carry the weight consistently. You see those guys that go to the gym and keep fit, they do it, they spend hours doing it. So if you're going to get a result from these exercises, you have to do them consistently. So we'll recommend that people do 8 to 15 pelvic floor exercises several times a day. You could do it up to 5 times a day. Okay, and it's not difficult. Okay, if you taught how to do it, it's not difficult to do it, and that can solve a whole lot of problems. So we do these radical prostate surgeries for people who have prostate cancers, and part of the complication that could result from that is urinary incontinence. But I can tell you that among the guys we did in Lagos, a whole lot of them that we did with my boss in Lagos, they achieved continence at some point, okay? And that's because they did a lot of these pelvic floor exercises. Pelvic floor, it's excellent. Whether it's a man or it's a woman, having to do pelvic floor exercises, it's something that can help resolve most of the stress incontinence issues. I mean, that's what people can do. The other things to be dietary advice, okay? Take high fiber diets. take high fiber diet, avoid constipation. These are things that people can do, okay, generally speaking, to strengthen or to prevent some of these things. If somebody has if somebody has urinary infection as a cause of incontinence, they need to treat it. It's not the one you go and take agbo jedi somewhere, you know. The agbo cures hypertension, it cures diabetes, it cures stroke.
Generational curse.
No, I mean, no. So I think that it is something that if you have infection and you've done a urine culture that shows what it is sensitive to, is to give the appropriate thing. These are some of the things that people can do. Now, having said that, that's what people can do on their own. There are some things that they cannot do on their own. If somebody is having urge incontinence from what we call overactive bladder, he needs to see a doctor. The doctor would properly evaluate him, as the case may be, and then recommend medication. Sometimes we give what we call antimuscarinics. Okay, so it depends on what the person is coming with. So, and sometimes we have to do not the regular tests you do by the roadside. We have to do what we call a urodynamic studies. Okay, look at the bladder, look at storage, look at voiding, look at the urethral profile. We have to put all manner of tubes and pipes just to assess the bladder function. And then on the basis of that, we could recommend medications. So I would advise, if somebody has done all these other conservative things we've talked about, you could just stroll into the hospital and see a specialist who will be able to assess properly and decide what to do. Having said that, sometimes people would have to do surgery to be able to do. I mean, if somebody has an anatomical problem, the pipe is not inserting properly, you would have to go and reinsert that pipe. We have to reimplant that ureter. Okay, if somebody has a fistula, there is nothing you are doing. That fistula will not close. You have to come. We'll do it. And and we've done that for a number of people who perhaps are grateful. I mean, sometimes once in a year they will send messages to say, "Oh, doctor, thank you, we appreciate you. God bless." You know, some of those messages, they are not as good as alerts. If I'll be very you prepare the bank alert, but some of those messages are very helpful and encouraging. Sure.
Thank you so much. Just like right now, I'm sorry I do not have a bank alert to give you, but I am so grateful. I am so grateful for your time this morning and all the breakdown that you did. Very, very enlightening. I really do appreciate it. And one thing that you can take out of this is that urinary incontinence is a big issue. It is not as small. It's not as small as you have been made to believe, and do not trivialize it, especially when you see somebody else going through it. Unfortunately, I could not take your calls and messages because we just had to break down and give the proper education on it. And if you have missed out on this conversation, you can go back to our YouTube channel. You'll find it. I will save it for you because you need to have this information and share it with someone else too. I'll put it up on our WhatsApp status so that you can just click on the link and it will take you straight to the video. Again, thank you, Dr. Chigozie. Always a very great time to have you.
Thank you.
Maybe one of these days, you will hear a pum pum on your phone. Thank you so much.
You're welcome.
Thank you, Lagos, and to everyone who sent in their messages. I do appreciate it. Sadly, I couldn't take it. So you know what will happen in some minutes' time? The kids will come join me because it will be the time for the kids game show. And 9 o'clock is for entertainment. Stay with us here on Smooth 98.1.
Love music. Love life.
Thank you so much. We were literally out of time. Hi, my guest. Yeah, you can help him sit downstairs. I'll come down when it's time to get in. Yeah, he's out here. Okay, I'm coming. All right. Thank you so much.
Yeah, sure. Thank you very much for having me.
Thank you. I will share the video with you so that.
All right. Yeah. All right. Bye.
Bye.
Yeah.
Thank you, YouTube. And thank you to everyone who was a part of the show. We have to go now. Bye.